Para ello tenemos con nosotros a Marten Kaevats. Él es asesor digital nacional, o sea, es el asesor nacional principal en materia digital en la oficina del gobierno de Estonia, o lo que sería semejante al director de innovación del país. Estudia el impacto de las tecnologías escalables en el comportamiento espacial de las personas y comunidades individuales, ya que cree que la revolución industrial y el modelo de vida hiperlocal crearán cambios reformatorios en el comportamiento espacial y social de las personas. Se graduó de un programa gubernamental de gestión de talento en 2017, tiene una formación previa como arquitecto y urbanista, fíjense qué interesante esta combinación para entender cómo hay que diagramar las soluciones digitales, es arquitecto, y ha sido el jefe de equipo curatorial de la ciudad automanejable, por así decirlo, Self-Driven City. Marten también es miembro activo de varias organizaciones de la sociedad civil, fue uno de los miembros fundadores de la Sociedad del Nuevo Mundo, que no es ninguna logia, sino que es la que en Estonia provocó grandes cambios reformatorios en la democracia participativa y una revolución en la misma sociedad civil, fundando y contribuyendo a la creación de la plataforma web comunitaria de software Community Tools, que se estableció en 2018. Específicamente su charla de hoy va a tener que ver con transformación digital y con salud digital y cuál es la arquitectura que la hace posible a nivel, digamos, global. Y en este sentido traigo a colación un acuerdo que firmó Estonia con la Organización Mundial de la Salud en octubre ahora, hace poquito, que es un paso significativo para que lo que funcionó en Estonia se pueda reproducir en el mundo a escala global, acelerando tanto la demanda como la oferta en la implementación. Y esto podría sentar las bases de un modelo de gobernanza global de datos a través de Naciones Unidas, no solo para salud, sino para todos los aspectos de los sistemas de información en general. Como ejemplo, nos ha comentado que una de las pruebas que se iba a hacer tenía que ver con un modelo de intercambiabilidad de datos de vacunas y es muy pertinente en esta condición de pandemia. Así que bueno, los dejo con él y después vamos a seguir con una agenda muy nutrida de oradores durante el resto de la tarde, todos speakers internacionales de renombre que tenemos el gusto de compartir. Marten, it's our pleasure to have you here now. The set is yours.
So hello everybody. I think Daniel made an introduction that was pretty long. Long story short, I'm the guy responsible for everything digital and innovation related here in Estonia. I advise the government and kind of the in-house visionary for Estonian government. But also on another role, I'm working for the World Health Organization, where I'm a member of the Digital Health Technical Advisory Group and advising the WHO or the World Health Organization in terms of global health data interoperability. So basically, I'm responsible for creating an architecture of trust, so that different countries and institutions would be able to trust each other's information. So that's a very long story short, but today I wanted to talk to you about the current situation. Probably all of us have noticed that the pandemic has changed our lives and we can't actually do things as it used to be. And for example, traveling has been restricted. People, I don't know the situation in Argentina that well, but I know that it's pretty dense and the quarantine rules are pretty tough. But one of the next challenges that will come is basically when there will be scientifically approved vaccine, then the problem will rise of how can actually different governments trust each other's information that vaccination or antibody tests actually happen. And this is the problem we are trying to address with the WHO. So what we are doing within the next half a year, basically, we are trying to deploy a global architecture of trust between all governments so that the economy and traveling and all sorts of things could come to the normal or closer to a normal or pre-pandemic situation. And I think it's very key that Argentina as a country, as a government, would participate in this this project, because if you want your citizens to actually travel the planet, do their vacations or do their business in other countries, then we need to do this. And we are looking currently, we are in the phase of looking for pathfinder countries. And if Argentina is up to that game, then I will try to describe how Argentina could become a pathfinder in Latin America to show your neighbors and other countries that actually traveling securely globally on a time of global pandemics is actually possible. So what are we actually doing? We are on the 5th of November, the Director General of WHO, World Health Organization, Dr. Tedros, and the Estonian Prime Minister signed a memorandum of understanding so that we will, together with the WHO, we will start the journey of learning where we will set up a number of different pilots to show that this kind of trust architecture works in various different locations, various different information systems, is based on open standards, and could potentially unite all different kinds of existing infrastructure. And what are we doing in practical terms is we are digitalizing the vaccination certification process. So as a kind of a metaphor, some of you probably while traveling have utilized or used this yellow vaccination passport, which is used for yellow fever and other illnesses such. We are digitalizing the yellow card as a kind of a symbolic thing. But very important of this is that this infrastructure that we build or we aim to deploy would work in various different conditions. Because this is a global project we're building, then it's key that it also works in super low income settings, poor countries, countries that not necessarily have the necessary capacities or digital infrastructure, or haven't not digitalized their healthcare systems. Because here in Estonia, we are lucky because most of our healthcare has been digitalized for 10 years, and we haven't been using paper for 10 years, basically, in terms of healthcare services. But in many other places, this is kind of very futuristic. So we aim to build this infrastructure as simple and as light as possible, so that different governments could have the potential of trusting each other's information. So how are we going to do this? And it's somehow even very kind of ironic that solving this kind of a global problem actually comes down to some very simple and basic things. In order to build such an architecture, we need to build trust between different stakeholders. The thing we need is that, for example, in Estonia, the list of certified healthcare providers is actually kept in an institution which in Estonia is called the Estonian Health Authority. I'm pretty sure that in Argentina, there is such an institution as well that manages the list of all certified healthcare providers. Basically the place where you keep an Excel sheet or a file where all of your hospitals, family doctors, all of the medical institutions in your country are kept. We need to get contact with those people. We need to get we need to link those lists up with WHO. And as a very simplified way, how I try to draw you the schematics of a global trust architecture. I have done, this is the first time I'm doing it. So if we can imagine that WHO is here. This is WHO. WHO means 195 different jurisdictions all over the world. Then we could imagine that, for example, Estonia is here, Argentina is here. sorry, like Estonia is like 445,000 square kilometers, and Argentina is a lot bigger. But still, they're independent countries, so you can compare them. In Estonia, this list is kept in the Estonian Health Authority. Probably in Argentina, there is also such a place. I don't know how it's called in Argentina, but there's a place where all of the certified healthcare providers are kept. The only thing we need to do is we need to make a global list here on the WHO side. And the only thing that WHO needs to know is where are these lists located in each of those countries. There will be something like 195 different circles like this, and all of them will go into WHO. And this is the very foundation and the basic trust architecture. But what's also important is that what 30 years of building a digital society in Estonia has taught us. Building a digital society actually has got very little to do with digital infrastructure of technology. It has got mostly to do with the mindset and culture of people. And a very big part of it is legal infrastructure. So if Argentina actually wants to become a part of this global program, which we are deploying in the next half a year, so it's a very tight schedule, then you immediately need to inform your government for them to actually participate, because we need to actually we need to build a legal architecture that is parallel with the digital architecture, which means that the government of Argentina needs to do a legally binding contract with WHO, where the government of Argentina states that in Argentina, this institution is responsible for keeping and maintaining that list. And that's it, nothing else. It's very simple. But it needs to be a solid legal architecture as well. And I presume that doing all of the contracts together with different governments of the world will take time. But if there is a will, there is also a solution. But with what this will actually help us to do is that if we know, for example, all of the hospitals in Argentina and all of the hospitals and laboratories that are certified and have the right to do vaccinations or antibody tests, then I don't know, making traveling possible between Estonia and Argentina is simple like that, because we know that those institutions that have done the vaccination or have done the antibody tests for, I don't know, Gustavo, Marten, or Daniel, then these institutions can actually provide the necessary trust so that while we are crossing the border, we can show a very simple QR code, but the border guard will then be sure that that information that you are showing them is adequate, trustworthy, and secure. So how are we going to do that? Is that Gustavo will explain after me that in Estonia, the backbone of Estonian digital society has been a distributed data exchange layer called the X-Road. X-Road is very simply put, data exchange architecture without central server, without Big Brother. Our kind of philosophy is that we don't put all eggs in one basket. We rather divide the eggs around 1,000 different baskets, and thus we make a secure by design architecture. We are going to use X-Road as the base layer for data exchange globally, because we can do a secure by design architecture with these kind of principles. Second element that we are going to utilize is blockchain. The certificates themselves will be blockchained, which means that the piece of paper or email or a QR code in your mobile phone that will look just as your boarding pass while you go traveling will actually be the single point of truth for those pieces of information. So the point is that I don't know, again, and this is the debate, how the healthcare architecture in Argentina is built. But if you already have some kind of an information system about vaccinations, then it's relatively easy to do, and doctors themselves that don't need to change anything. It's a small thing that operates in the background, but what it means is that all of the citizens who got their antibody tests or got their vaccination done, then they will receive a certificate by that same healthcare institution, let's say a hospital in Buenos Aires or a hospital in Neuquén. And that certificate will be recognized globally. But in order to do that, we need to find contacts within different institutions in Argentina. We need to find people who, we need to get contact with your health minister. We need to get contact with the health authority who is keeping the list. We need to get contact with the border guard, the boss of the border guard. And we need to get contact with the digital minister as well, probably. And if there is interest in participating in this global venture, then please take contact with either Gustavo, who knows how to build this kind of infrastructure, or Gustavo can connect immediately to me as well. But also, if you want to go through official channels, the Estonian Ministry of Foreign Affairs is the point of contact for you. But why is this necessary? Is that we are actually starting to build this global interoperability architecture with the use case of digital vaccination certificate. But it's important to understand that when Argentina would be actually involved in this interoperability scheme, then you can start building whatever kind of health data service across the borders from that point on, which means that, for example, we have very good contacts in Chile as well. And probably there is a lot of people moving, I don't know, to work in Chile and to do business in Chile, and Chilean citizens are coming to Argentina. Then if Chile and Argentina actually are both involved in that, then building any kind of health data interoperability between those countries becomes much, much easier, because both of the sides are sure that the institutions that certify this information, the hospitals and places where doctors are working, that they are actually trustworthy. But again, this is only the beginning. Hopefully in the next, let's say, half a year, we are able to cover about, okay, maybe I'm optimistic, but half of the world. That means like 100, let's say 100 countries, maybe 90 countries, like that. But important is that we will start adding lots and lots of new functions to this trust network, and we can actually build other kinds of services on top of it. For example, we are working with a Swiss-based artificial intelligence AI research center, IDER, which aims to actually build open and free artificial intelligence solutions for healthcare providers all around the world. And we are also working together with international telecommunication to build this kind of, to bring this kind of tools and technology to places where this kind of technology is non-existent. And I think it's a very unique opportunity and time for the planet, because I think what the pandemic has shown us is that we are in this shit together. It doesn't matter whether you're in Argentina or whether you are in Estonia or whether you are in China or whether you are in the US, we are in this together. And the need to build trust is imminent. We need to build relationships, and we need to be able to trust each other's information, what we can show each other. Estonia is building this together with WHO, with other member countries. And we are really, really hoping that Argentina would be also able to participate as one of the pathfinder countries. And for doctors and for medical people who might be listening this, then the important thing is that we are actually making the amount of work smaller a bit, the amount of bureaucracy involved smaller a bit, rather than generating extra. We actually aim to make it as smooth, as simple as possible. And the main thing is about trusting each other's information and making this global. For Estonia, our role in it is to become kind of the honest broker in this, because this is a, let's say, highly political game. But we are in a country, small country of 1.3 million people. Our only thing is that we have this experience. We have been building a digital society that some of the countries call the most advanced digital society in the world for the last 30 years. And we have experienced building trust within the society. I know that trust is actually a cultural thing, and digital things are tools that maybe can help to build it. But we are still hoping that in this very unique set of circumstances, meaning the global pandemic, we can actually deploy a global health data interoperability layer, which means that we can make, in long term, all healthcare systems on this planet work together, exchange information in a secure, private way, in a privacy preserving way, in a human-centric way, which means that I'm the owner of my data and I'm in the control of it. And basically, I'm really hoping that somebody in Argentina who can help, then please, let's get this pilot working also in Argentina. I think it's critical for your own economy. We need to get, if you want your citizens to start moving around, doing business, going to vacations, then I think it is critical for you to also participate. I'm guessing that it all has clear economic value to the government as well. But still, it's about fundamentally building a global community of trust. And this is what we are doing. I'm really hoping that Gustavo can explain the technical nuances, a little bit technical, not too technical, better in Spanish, because he has been actually one of the oldest members of this X-Road club, and has actually been practicing the X-Road architecture, the distributed architecture in Neuquén since 2008. So thank you, Gustavo, for that. And I will end now, for example.